Do you have questions about your health? Do you need to find out what's keeping you from feeling your absolute best? If so, your intuition has guided you to the right place. I am Dr. Charlyce, and welcome to the Art of Healing podcast community. In this podcast, we explore all topics in health and wellness, from Reiki to functional medicine, energy medicine, chakras, and meditation. Join me every week for fresh new episodes that highlight healers, various healing modalities, and use this as your opportunity to find what healing works best for you. If you want to learn more about me, simply Google at Dr. Charlyce. Enjoy. Welcome back to the Art of Healing podcast. This is Dr. Charlyce. And as always, thank you for joining me for today's episode, which is May is Mental Health Month. When we talk about mental health, we could be talking about our mental wellness, which is our ability to focus, our ability to feel joy, to feel happiness, connecting with others in a meaningful way. And then we could also be talking about mental health in terms of not feeling well. There's a term in medicine called dysthymia, in which your mood's not good, but you don't have clinical depression, or feeling apathy, which is, again, not full depression, just not appreciating joy that you want to appreciate, just not quite feeling yourself. And then, of course, we could also be talking about mental health in terms of diagnosis. And those are when the mental environment has become pervasive and chronic and has not backed off and has led to things such as full-on major depression disorder or generalized anxiety disorder or bipolar disorder. But no matter where you are, you can tell what I'm leading up to is mental health is important for all of us. We all have to think about our mental health. According to the National Alliance on Mental Illness, 22.8% of U.S. adults experience mental illness in the year 2021, and 5.5% of U.S. adults experience serious mental illness. So that's up to 1 in 20 adults. Nearly 17% of U.S. youths experience some kind of mental disorder. And this is going to be young people between the ages of 6 and 17. And up to nearly 8% of adults experience mental health disorders in combination with substance use disorders. And it's not that we necessarily need the numbers to remind us, because these were before the pandemic, but it's an excellent reminder to all of us that when it comes to mental health, illness, mental wellness, that to some extent we're all at risk. And if it's not us personally, it's someone that we know and love. So knowing how common feeling unwell mentally and mental health disorders are, our discussion today is important. It's definitely worth taking note of. So I want to let you know that the Art of Healing community, the healing arts community in Dr. Charlyce, we have been meeting monthly. We've been doing a free Zoom call or a masterclass. So we'll be doing one this month as well. We'll be meeting on May 25th. At noon Central Standard Time. If you check your show notes, you'll see a link to go to the landing page that will sign you up. I'm finding out that works best is to have you register through the landing page first so that I know who's coming. Then the details of the meeting will come out within about a week to a few days before the meeting. So we are going to be discussing my recommendations for mental health and wellness, a toolkit of sorts. And with attending this class, you'll come away with some tools that you can use to maintain mental health, to have a look if you don't think you're so mentally healthy, and some next steps to take. If you're interested, I would definitely encourage you to sign up. When you sign up, you do get a recording sent to you But so far, having met 3 times, it's a really nice community, and it's nice for you all to get to meet each other. So I wanted to make sure that I plug that because I'm noticing that the same folks are attending, really getting to know each other. It's a new endeavor. So I think that meeting every month, we can see where this takes us. So the most common mental health disorders, which most of us probably are somewhat familiar with, but at the top of the list, major depressive disorder will be the most common. And this is the clinical condition in which a person suffers from a cluster of symptoms that range from depressed mood, sadness, apathy that we mentioned before, sleeping all the time or not being able to sleep, having changes in the weight, either going up or down, changes in appetite, either more appetite or less appetite. I'll make sure I'll put in the show notes. Being able to assess yourself for depression is actually a thing now. Of course, you need to be under the care of a physician, but you can actually gauge your own depression risk with answering 2 questions. So we can do those 2 questions together right now. So in the past 2 weeks, how often have you been bothered with any of the following? In the past 2 weeks, have you had little interest or pleasure in doing things? And if you would answer yes, would that be not at all, 0, several days, that's a score of 1, more than half the days, that's a score of 2, nearly every day is a score of 3. And the second question is, in the past 2 weeks, how often have you felt down, depressed, or hopeless? 0, none at all. Several days, that's a score of 1. More than half the days, that's a score of 2. And nearly every day is a score of 3. And if you answer yes to any of those, it's actually time to think about next steps. So although that seems really brief and really short and like probably not enough time to know, is this, am I really having some depression? It turns out that several clinical studies show that just 2 questions is quite sensitive for knowing if someone's at risk of having depression. Now, it doesn't mean that you require treatment, and quite the opposite. If you are answering yes to those tests, what it tells you is that it's time to be proactive about your mental health and take some steps to improve your health right now. Depression is associated with physical diseases. So it's not something that's just in the brain. And matter of fact, many studies are showing that depression really isn't in the brain at all. It's more likely in the gut, but that's a topic for another conversation, isn't it? With depression, we see increased risk of heart disease. It's a well-known statistic that for individuals that suffer from a myocardial infarction, they have a high risk of developing major depression. It used to be, the thinking was that they were just depressed because they had this horrible thing happen to them by having a heart attack. But it turns out there's some neurobiochemical changes within the heart and the brain that are so high risk of leading to clinical depression that patients must be screened for depression, and physicians treating patients after a heart attack must be ready to treat them for depression because it so commonly occurs. And that can make recovery from a major event like a heart attack much more difficult. A heart attack is when the heart loses blood flow. So those people come out of the event feeling very tired, having chest pain, not feeling well, and recovering from a surgical procedure, in addition to being on many medications. And then to take the additional hit of feeling depression that starts often weeks and months after the major event, very difficult. Depression is also associated with developing diabetes. It is so common for people that are developing diabetes to have symptoms of depression, so much so that sometimes when I'm working with a patient, you can't even tell which came first. Because for the person that goes on to develop diabetes, they're often having depression symptoms 6 months to a year before becoming diabetic. But then that's also confusing because the symptoms of diabetes are terrible for the mood. Fatigue and anxiety and all those things what a blood sugar fluctuation would cause also are being caused by depression. But there's a strong tie of depression and diabetes, and also a strong tie for individuals that are having trouble improving their diabetes or recovering from diabetes. In my practice, we view diseases differently than the way they're viewed in traditional medicine. So in our community, we don't see diabetes as a permanent disorder. The way we see it is a temporary disorder that is very much impacting your health, but we anticipate recovery from it. We may have to come up with a number of strategies to help your body heal from diabetes, but the way we see it in the membership practice, diabetes is not permanent. So with my own patients, if we're having trouble with improving the metabolism, improving diabetes, we have an open discussion about what's happening in the mental health landscape. And many times that's where we're missing the mark, that we may be focusing too much on the nutrition, too much on the muscle movement and the mitochondria, and we're totally missing the mark on maybe something that my patient has gone through that's re-traumatized them and has brought their mood down. And that's what's causing their blood sugars not to be going in the way that we want them to go. Anxiety is the next most common mental health disorder that many of us will suffer from. There is the sensation or feeling of anxiety, and there's temporary states of anxiety, but generalized anxiety disorder is the pervasive feeling of doom and gloom, something bad's going to happen. It is the activation of the sympathetic nervous system, and basically the body and the mind are tuned in such a way that everything is working well in terms of survival, but it is not working well as far as rest, digest, and flourish. So that means that sleep's disrupted, digestion is disrupted, mood is disrupted, sexual function is disrupted, elimination of waste is disrupted. All of these systems start to take a toll as the body stays in a state of chronic stress. So it's not unusual that we see individuals that are suffering from generalized anxiety disorder suffering more frequently from chronic pain, digestive disorders, heart issues, especially high blood pressure. For individuals that have chronic high blood pressure, there is an element of anxiety to your disease. Whether or not that is on the conscious or the subconscious levels, totally different, but it definitely is there. Your hypertension or high blood pressure, unless it has a known and obvious cause, more than likely has something to do with your autonomic system being in a constant state of stress and changing your hormone system so that everything is tuned to stress, creating a system in which your blood pressure stays higher than it needs to be all of the time. There are actually a number of questionnaires online that you can do for yourself if you are concerned about having a generalized anxiety disorder, and I'll make sure to put that in the show notes. And again, that's not the same as just being anxious some of the time. But either with that and depression, just know that even if you're worried about possibly developing it, it's definitely time to talk about it, definitely time to take some preventative steps, or if you're already being treated for those, really just reacquainting yourself with what that feels like, and maybe even having a look at anything else that's going on in your body. and if there's a relationship to that and the mental health issue that you are trying to heal. Another common mental health disorder is bipolar disorder, which, according to the Substance Abuse and Mental Health Services Administration, or SAMHSA, is a serious mental illness in which unusual shifts in the mood, ranging from extreme highs to extreme lows, are present. And the person who suffers from bipolar disorder has changes in their energy, thinking, and sleep. Bipolar disorder has a number of variations. So there's a bipolar disorder that's characterized more of having the mania or too much energy. There's a bipolar disorder that's characterized as having the depression part, and then there's variations in between. Bipolar disorder is difficult in the diagnostic stage because as far as this shifting of mood, I've heard people say commonly in conversation on social media, oh, I felt so bipolar. I felt so, and what they're referencing is, or I'm assuming what they're referencing is that their mood changed rapidly. They went from happy to angry or sad to joyful or something like that, where the mood shifted quickly. While that is an aspect of bipolar disorder, in general, in bipolar disorder, those states of being are going for a long time, over several months to even years, where a person may live in mania and not realize it. And then because of biochemical changes, the brain and the nervous system becoming just simply burnt out, shifts to a state of depression in which the person cannot function, can't do as much, is feeling frustrated because they may recall 3 or 4 months ago they could work 2 jobs, run on 2 hours of sleep, still have time to party with friends, still drink, still this long list of things they were doing, to now not getting out of bed for 20 hours a day. For people who are surviving bipolar disorder, this becomes a reality. But this is a very painful and uncomfortable way to live because the mania has consequences on the mind, the body, and the life. Individuals that are having mania can often make very bad decisions because they have more energy, will often feel that they can accomplish things that they aren't capable of. Things that can occur during mania are spending money that you don't have to the point that it looks like a shopping disorder. Some people with mania may engage in things like gambling. Some people may engage in behaviors such as abuse of illicit drugs or excessive behaviors like having multiple sexual partners, and that's not normally something that they would do. And when people are in mania, typically this isn't a state they stay in all of the time. It tends to be something that's going on for several months. And then for reasons we understand and don't, there's a shift in which a person crashes, and then the exact opposite state exists. So when that depression sets in, it means that the person doesn't have the energy to do things that they want to do, possibly aren't functional. And it's also a dangerous place to be because in that depression or even in the mania, self-harm is a real reality. And I did forget to mention that if you're listening to this and you're in a bad place and you're actually, if some of this is resonating with you, particularly this self-harm, there are resources that you can reach out to pretty much worldwide. Definitely in the United States, if you dial 988 from any phone, you can connect to someone to talk to right away if you were in a mental health crisis. So as we're traversing through this, please don't feel prideful. If you're hearing this and maybe I'm uncovering something very deep with you, you should reach out for help. Absolutely. You should call 988, call your physician if some of this is resonating with you. But do understand that especially thoughts of harm, death, you dying, killing yourself, hurting yourself is not normal and is treatable and something can actually be done. But in particular, bipolar disorder, that's when things can become dangerous, because in those extreme states, the judgment and the thinking don't correlate with who the person really is. So that covers the most common mental health disorders or mental issues, illnesses. I wanted to do an overview because throughout this month, we're going to touch on these. We're going to touch on some of the biological consequences of these. And then towards the end of the month, during the masterclass that we'll have together, we'll talk about first steps that you can take if this is you. Now, if you are someone who is suffering from one of these disorders and you're wondering if there is a different approach than traditional medicine, which can be multiple pharmaceuticals, yes, there is. So I encourage you, if after this podcast you are interested, you can sign up for a free call with me. Now, my services are not available in every state. However, I've found that just with the connection call, we can figure out something that can help you, even if it's not directly working with me. So as always, thank you so much for listening to the podcast. Make sure you check your show notes so that you know how to connect for this month's masterclass, which will be exciting. And if you are not on my email list, you should definitely sign up, because in the email, you get a copy of this podcast and other resources and information. Thank you for joining me, and I'll see you next week. Thank you so much for joining during this episode of the Art of Healing podcast. If you found this episode helpful, please leave a review. Also, you can check your show notes to find out how to get a copy of this and future episodes emailed directly to your inbox, available to listen to anytime. Finally, if you have questions or wish to connect to me, check your show notes to find out how we can get connected and find out how I can be of service to you.